And I'm also going to turn on the captions, and you can turn those on or off by toggling the closed caption icon at the bottom of your screen. We'll have today we'll have about 35 to 40 minutes for Dr. Jones's presentation. She's asked to take questions of clarification as we go, but to hold questions for discussion until the end of the session. We'll plan to wrap up about 12:55, which will leave us 15 minutes for her to meet with our postdoc and pre-doc trainees. So I think those are the usual caveats that we have out of the way. We will not have a brown bag event next week. We'll resume on November 29th. So I hope we'll see you then for the last brown bag of the semester. So to turn to our introduction, Dr. Malia Jones is an interdisciplinary researcher working at the intersection of infectious disease and social epidemiology, demography, and geography. She's an associate scientist in health geography at UW-Madison in the Applied Population Laboratory, and her work focuses on how the places we spend time affect our health, particularly spatial clustering of infectious disease and vaccines. She is a co-founder and the inaugural editor-in-chief of Dear Pandemic, which has curated and disseminated scientific information about COVID and vaccines via social media since March 2020. Dear Pandemic has its own website and also has over 10,000 followers on Twitter and over 100,000 followers on Facebook. Her current research work is funded, over the past year, Dr. Jones has emerged as a national leader in pandemic-related science communications, and she is now developing a research program that aims to understand how social media, trust, and science communication intersect. And I think that we're all in a position to understand how incredibly valuable that work is to science and to public well-being. Her current research work is funded by a K01 Career Development Award from the National Institutes for Allergy and Infectious Disease, and a grant from the Centers for Disease Control and Prevention and the Wisconsin Department of Health Services. She received an MPH and a PhD in public health at UCLA and completed her postdoctoral training at USC's Keck School of Medicine and the Department of Preventive Medicine. Her work has been published in leading scientific journals, such as the American Journal of Public Health, Health Affairs, and Demography. So I will turn things over to her for her presentation, and thank you again for joining us. It's a real pleasure to have you here.
Thank you, Paula, for that introduction. That's quite a bio. I need to cut that blurb down, huh? Thanks so much, everyone, for joining me today for this hour. I really appreciate you showing up on Zoom. I know it is exhausting to be on Zoom all the time, so I really value the time you're spending with me. And I want to also shout out to Dr. Jennifer Dowd, who is here with us today. She is one of my co-founders and is actually the current editor-in-chief at Dear Pandemic. So if she has anything to contribute here, I invite Jen to just jump in and help me out. So I'm going to share my slides. I'll talk a little bit today about what Dear Pandemic is, how we ended up doing what we're doing, and then sort of future next steps, future directions for Dear Pandemic. I'm also going to give you a really quick sneak peek of some very interesting work. I think it's interesting work that we're doing using the questions that have been submitted to Dear Pandemic to analyze and kind of take some lessons learned about how to communicate science in a public health emergency. So hopefully, Paula, can you give me a thumbs up that you can see my slides again? Did I choose the right window? Okay, great. So I've titled this kind of generically lessons learned on the COVID-19 infodemic front lines. And briefly, I'll talk about some of these core messages and how we frame them as a science communication platform, as well as our methods for soliciting questions from readers. And then I'll turn to few next steps and future directions. So let's start with the infodemic. If you feel like you are drowning in information, or if you have at some point during the pandemic, that has a name, and it's called an infodemic. And WHO has identified the infodemic as an overabundance of information, both on and offline. And they say that misinformation, disinformation, and just generally too much information can be harmful to people's physical and mental health, increase stigma, threaten public health gains, and lead to poor observance of public health measures. And they have really identified this as a priority area for dealing with public health emergencies in addition to the pandemic itself. And so this is the statement that they released about the infodemic early in the COVID-19 pandemic, when they at WHO realized that this overabundance of information was really going to be a major challenge during this pandemic. And thinking about this, I really think that it is an old problem that misinformation and disinformation spread very rapidly, but it has all new scope and speed thanks to social media. This is the first pandemic. This is not the first pandemic we have ever faced as a species, but it is the first pandemic we've ever faced in the context of social media and the kind of the U generation of social media. So social media has really revolutionized the way that information spreads, and that's particularly true of false information. And I found this great quote from Jonathan Swift in 1710 that said, "Falsehood flies and the truth comes limping after it." And that really does kind of sum up how I have often felt doing the work of social media-based science communication during the pandemic. It just sometimes feels like whack-a-mole. Every minute there's another falsehood that you're trying to knock down. So information, as I said, does really fly on social media. And that's, I think, because the algorithms of social media respond better to the provocativeness, to the click factor, to the shareability of content than to its quality or its truthiness. And so we really need to pay attention to the role of social media in spreading misinformation and disinformation. It's a critical public health field that is just emerging. It's actually been around for a while in risk communications, but I think it's just emerged into the spotlight of more general public health. So what is different about the COVID-19 pandemic? Well, it's social media. It has really changed the whole diffusion of innovation landscape. And this is a quote from an article that came out early in the pandemic talking about social media that says that just social media has rapidly become crucial for information generation, dissemination, and consumption. And we've seen that that is particularly true of misinformation. So to back up a little bit, I'll give a little intro to who I am and how this work all started, and then I'll talk about what Dear Pandemic does. So I'm an infectious disease scientist. I study how diseases spread through groups of people, particularly in geographic space. And as Paula said, I have training in epidemiology, community health, demography, and geography. And I was really called to do this work because I value the power of community to achieve things. So the notion of public health that we can work together or that we can implement something at the population level that will improve everyone's lives and repair historical injustices. That's really what public health does, and that is what called me to public health in the first place. I am now at the University of Wisconsin-Madison at the Applied Population Lab. They just changed my title. I'm now a scientist 3, not an associate scientist. I need to update this slide. And also the co-founder of Dear Pandemic. And that happened really on accident. As the pandemic started very early on, first week of March, I woke up one morning, I study herd immunity and infectious diseases, and realized that this was, I was starting to get a lot of questions from my friends and family members, and realized that this was really a thing, that the pandemic was in the United States, that it was spreading. We had community spread in several different sites within the US. The CDC had just changed the criteria for who could be tested, which was kind of a tacit acknowledgement that we had community spread. And so I wrote this email to my friends and family members, and it was just like kind of some practical tips for what to do next and what I saw happening around me. That email, some of you may have seen it. It went totally viral. First in my email, it got forwarded all around to lots of different people, and then eventually ended up on Facebook. And on Facebook, it got over 1 million views. And then it wasn't too long after that I received a phone call from my collaborator, Allison Buttenheim, who's shown up here at the top right. Allison was also receiving a bunch of media attention. We were both feeling very overwhelmed with all the huge influx of calls and questions. I was getting, my email address was on that email because it was an email. And so I was getting personal emails from, at one point, hundreds of people per hour asking questions that were questions, like very practical questions. I'm in this particular situation, what should I do? And there was not a source for answers to those questions. So I was trying to respond to them the best I could. It was really an overwhelming time. So Allison and I had this phone call where we kind of laughed and said, haha, we're famous now. And next thing you know, Dr. Oz will be calling us. And then the next day, Dr. Phil's producer called me. I was like, okay, this is too weird. So I ended up on the Dr. Phil show talking about social epidemiology and how infections spread through groups of people. While I was doing that, Allison, at the suggestion of one of her colleagues, launched Dear Pandemic on Instagram and Facebook. And Dear Pandemic, the idea was just to consolidate the efforts that we were making to answer people's really practical daily life questions and answer them in a public forum on social media. And this quickly grew. We reached out to other friends and collaborators, including Jen Dowd and many others, and built this collaboration of women who are clinicians, population scientists, epidemiologists, and other areas of expertise who are really interested in engaging as scientists with the public directly to try to produce change, to try to produce a better understanding of the infodemic and the pandemic. And so that all happened in March of 2020, and it's just kind of grown from there. I will talk some more about how it's grown. So our mission is to educate and empower people to navigate the overwhelming amount of information circulating during the pandemic. So it's directly addressing the infodemic itself. I think we have changed people's behavior. I think we probably have saved at least one person's life with the work, the behavior change recommendations that we're making, but our main goal is really to address the infodemic. This is a screenshot of our website, which you can see is a searchable, there's a search field, there's a place on here to submit questions to us, and you can also subscribe to our newsletter on here. We're a team of more than 20 doctorally trained researchers and clinicians. We have 2 PhD trained nurse practitioners, 3 PhD trained nurse practitioners, an MD, a DO, immunologists, family medicine, mental health, economics, lots of different areas of expertise. We also have 1 core retired middle school teacher who is our chief operations officer, and Gretchen Peterson, is really the glue that holds the whole team together and makes it all work. So the work that we do through 2 aims, and these are to disseminate trustworthy, comprehensive, and timely scientific content about the pandemic to lay audiences, and we do that on social media. And then our other aim is actually to promote media and science literacy and information hygiene practices. So we're trying to train our readers to better understand what their information ecosystem looks like and how to manage it. And what we actually do is we post between 8 and 14 unique content posts every week for the last, it's more than 55 weeks, and it's much more now. What are we, 20 months in and counting. We have more than 1,500 questions that we have answered about the pandemic so far. And we're on 8 different channels, Facebook, Instagram, Twitter, LinkedIn. We have an email newsletter and a website. And then we have 1 Spanish language channel called Career Pandemia, which is on Facebook only. At one point, we were receiving 250 questions a week from our readers. And that has declined in recent days. It's interesting to see how the ebb and flow of information seeking behavior really goes. But at its peak, it was well, actually the peak day was a lot more than that, but something like 250 questions per week. When we post things, we can kind of classify the posts that we do into a couple of different categories. And I'd say the first one is addressing misinformation or disinformation. So this example, did a lab leak cause the COVID-19 outbreak? These are just the images that go with the post. There's also typically a fairly long essay that goes, or fairly long for social media essay that goes along with these. Jen and I have tried to keep them shorter as the editors, but scientists are terrible at writing things that are short. So it's an ongoing challenge. We also do information hygiene posts. There's this example, where to go for good science news. Can I get the COVID-19 vaccine at the same time as another vaccine is an example of one of our kind of practical living posts. So advice for what to do, how to behave in the current day-to-day context of the pandemic. And then finally, we do posts on mental health and mental health hygiene. And so this last one is an example of one of those posts on mental health, because as we know, one of the major health impacts of the pandemic has been very detrimental effects on people's mental health. So a few stats: we have about 105,000 followers on Facebook, 50,000 followers on Facebook in Spanish, and then, altogether some additional 100,000 or so followers on different channels. We have a monthly reach of about 1 million people, 1 million views per month. And that is trending down as interest in the pandemic is kind of starting to taper off in the United States. Most of our followers are in the United States on our English channels. Our Spanish channels are actually much more international. Our top country that we reach there is Argentina. And so there's, at this point, Carita pandemia is growing much faster than Dear Pandemic is. We've also, as a group, done over 600 news media appearances. So tons and tons of interview opportunities as well. And we see this as one of the ways that we really can get our message out there. So sometimes people ask me, aren't you just preaching to the choir though? You're kind of, the people you reach on social media are the people who don't need to hear this message, or how do you reach the people who need to hear this message? Well, I think the real service of Dear Pandemic is that our content is shareable. So it's native to social media. We post it on Facebook and on Twitter and on Instagram. And then our readers who do come to us already agreeing. That's how social media works, right? The algorithms show our content to people who are going to agree with it. They have much more diverse perspectives in their own networks than is represented in our readership directly. And so when our readers share our posts, they're actually that secondhand reach, that second order reach is, I think those are the people who really need to hear our messages. And they're hearing it from someone in their network who they presumably know and trust to some degree. So I think that's a really powerful tool for producing health communications that is effective and that people find trustworthy. And I'm going to return to that idea of trust in social media. So how do we actually do this? It has been hard. It has been really challenging and especially during the peak of this work was taking up a lot of everyone's bandwidth, right? This is a totally volunteer operation. Nobody is funded or getting paid for any of the work that we're doing. And it's been a lot of work, but we get it done through this amazing team of really independent, smart, talented, collaborative, and committed women. We have really good division of labor and also really good sharing of labor. So when one person, is out sick because her kids all got COVID and her family is now, laid low for 2 weeks, we have enough contributors that we can pick up each other's drop balls and fill in each other's cracks. We do this all on a very active Slack workspace. And so sometimes I half jokingly say that the real secret to Dear Pandemic is Slack. we spend a lot of time there, and that is really what makes it all work, that back channel communication network. So I want to talk a little bit about the life cycle of a post, just to introduce the idea of how we do science communication. So the first part of a post is that people have questions. There are questions out there. People will put them in the comment box. They'll email them to us. They put them all over the place. Any chance they get to ask us questions, they send their questions to us. One of the main ways that we get information about what people need to know is that we have a question box. And this is a really simple web form that's available from our website. We try to direct people from social media to the question box to submit their questions. And then we end up with this spreadsheet that has the questions that have been submitted, right? And so this is a form of social listening. And it turns out it's a very informative way to identify what's kind of trending in the misinformation world, in the news cycle, and also what's missing from the news that's out there. And it turns out what's often missing is the practical, applied, real life, what am I supposed to do about this latest piece of information? So we look at the content of the question box each week. I used to read it myself. Now I don't anymore, and I'll return to that later on. We do kind of a roundup to see what the themes are in the question box, and then we pick which themes really need to be addressed the most through this social listening process. Then we have volunteers, this collaboration of volunteers sign up to tackle one of these topics that appeared in the question box and schedule themselves to write a post. They write it, they produce a little Canva image that goes with the post. The Canva templates were designed by a graphic designer, and she is actually the only person who's gotten paid for her work with Dear Pandemic. She did a great job designing those graphics for us. Then we post it to Facebook, as well as repost it to Twitter and Instagram. There's kind of a process, a pipeline for those things to be disseminated. Ultimately, many of the posts are also translated into Spanish and posted on our Spanish language channel. And then people have questions. I'll give you an example. I posted this morning about this news that the white-tailed deer population of the United States is widely infected with SARS-CoV-2. And I forgot one of our key lessons learned, which is that people genuinely don't care about the basic science of the pandemic. They just want to know what to do. So I posted this thing about how, interesting and terrible news it is that the deer are infected, and it was a little sciencey. And everybody was like, okay, but what about hunting season? It has to be really practical. So they put those questions in the comment box. We try to redirect those people back to the question box on our website. People often share those comments to others in their social networks. Oh, you know what? I forgot a key step here. It's one of these little icons, I forgot what it represented. This one. So after a post is written, we like to have it posted internally for like a quickie peer review process. And so most of our posts, unless they really happen at the last minute, do go through a quick peer review process before they go up on Facebook. Then they get posted to Facebook, people share them, and that is where a lot of our reach comes from. And as I said, I think it's really where the impact of the work that we do happens. And then people have questions, people say nasty things, people disagree. We do quite a bit of monitoring of the comments and hide the nasty ones and ban repeat offenders. And then we try to direct the questions back to the question box so that we can start the cycle again. I will almost certainly have to post a follow-up to my Dear Pandemic post with some practical information about what hunters should do and what hunters should be thinking about as they go into this fall hunting season. So I want to touch on some preliminary findings on this analysis that's led by one of our collaborators, Alexandra Golos of Penn. and Allison Buttenheim, also of Penn, they have led an analysis using natural language processing of the submissions to the question box. And they, Alexandra picked a window from when we opened the question box on August 24th, 2020 to 1 year later. In 2021, we got almost 4,000 submissions to the question box over that period of time. I read almost all of them, or if not all of them personally, between August of 2020 to May of 2021, at which point I hit my absolute pandemic limit and really experienced burnout like I have never experienced it before. And at that point, I handed off the editor-in-chiefship to Jen Dowd. She graciously took over. She actually took over a whole month early because I just literally couldn't anymore. I had to quit. And then I kind of took some mental health time over the summer because it was really bad. It was like real bad in May of 2021. I'm doing better now, so it's okay. So we took these, Alexandra took these submissions to the question box. She ran them through natural language processing algorithm to find themes. And we were able to classify the submissions into 6 overarching themes and 25 unique topics. And it's very interesting to look at what these topics look like, and particularly, I think, to look at how they have trended over time. So I'm just going to show you one example of this. This is just sort of a taste of this empirical work. One of the topics that we identified was vaccine dosing and timing. And you can see the most highly associated words here are things like dose, get, first, second, shot, Pfizer, week, things about vaccine dosing and timing. And what I think is really fascinating about this analysis is you might, as scientists, you would look at that set of words and think people are asking immunology questions about dosing and timing, but they're not. They're asking super practical, applied, pragmatic questions. The vaccine is supposed to be effective for 6 months. Is that 6 months from the first shot, the second shot, or from the 2 weeks after the second shot? Right? This person kind of, I don't know, it's almost like folks miss they miss the big picture. They're missing kind of the scientific orientation that would lead them to know the answer to that question, which is that, like, it's an estimate. We don't actually know if it's 6 months on the nose. It's not like a date on your calendar when your vaccine expires, like it's milk, right? People don't have the scientific literacy to interpret the information that they're getting like that. But what they need is someone to just give them some pragmatic advice about what to do. Like, do I mark this on my calendar? And if so, on which day, right? So this is one of my big takeaways from having done this work, is that we as communicators often focus too much on the theoretical science and too little on the pragmatic details of what people really need to do in terms of behavior. So I will just show you an example of how these topics trend over time. This is a great big graph that I love so much. I could spend all day looking at this graph that Alexandra made, or this figure. There's a graph for each of the 25 topics that she identified using natural language processing and how they have trended over time. And you see some really interesting and very predictable trends, right, that are timed with the news cycle and with the events as they've unfolded of the pandemic. And so I'm just going to zoom in on that one that I just showed you, which is the COVID-19 vaccine dose and timing, and show you how this has trended over time. So back at the beginning of the question box in August, we were getting very few questions about dose and timing. There was no vaccine available, right? December was when the first vaccines were emergency use authorized, but really only a select few people were eligible at that point because of supply issues. But then it quickly trended up and peaked around when the general population was able to get the vaccine. And so you can see here that people really were submitting these very practical questions about the information that they needed to figure out what to do tomorrow about the current situation of the pandemic. So some takeaways of what I've learned doing this science communication work over the course of the past 20 months. I think one of the things we've learned is that trust is actually even more important than truth when it comes to communication. We tend to take information from people we trust much more seriously than information from strangers or people we don't know or trust. So, and that's true even when we know the source is questionable. So when we see something on social media that a friend has shared, we are very apt to believe it, even if we have, and even if our rational mind is thinking like, is that really true? That doesn't sound quite right. It's very sticky when we hear information from someone we trust. And so one of the key things that we need to do as communicators is build trust and become that trusted source of information. Second, be specific and practical and make it really useful. So, when we're interpreting our results for a general audience, the first thing we need to be thinking about is how do people use this information today? Not like what's interesting about it or what are next steps or, what are the scientific implications. People don't want to hear numbers. They don't want to hear really any of the things that we as scientists mostly want to know. They want to know what to do. And then finally, it really helps if you make it painless. Better yet, make it funny. Dear pandemic, it's not always possible to be funny about a pandemic, but when we can, we have tried to make it as entertaining and as engaging as possible. Jen has a really special talent for this. Actually, she's written some very amusing posts about the potential fertility effects of having COVID-19 in particular. So what's next for Dear Pandemic? As I said at the outset, this has all been volunteer work. There's no funding to back Dear Pandemic. And part of the challenge of that is that, getting grant funding, particularly federal grant funding, as everyone here no doubt knows, takes forever. And, back in April 2020, it was very hard to think of some NIH proposal aims that we knew 2 years in advance would still be salient, right? Because that's how long that grant cycle takes. I think we are finally at a point where I can forecast what I think will still be salient in 2 years from now when I manage to get some NIH funding for this work. And so what I'm working on now largely is NIH directed proposals to fund future studies, some of them about science communications, in general, some of them about Dear Pandemic's work quite specifically. And I'm especially interested in the potential spillover effects of all this new attention on vaccines on childhood vaccinations. So I'm working on some grant proposals related to that. What's actually going to happen with Dear Pandemic next? I don't know. We have really never known where we're headed with this. The whole project has been very much fly by the seat of your pants. Everyone wants to keep it going, and Jen has done a really good job of doing that after I bailed out on being the editor-in-chief, and I hope it continues for a long time. Interest is waning in the content that we're posting, and so I don't know if there's a moment coming up for us to change tacks, start posting about different stuff. We've experimented with that a little bit, but your guess is as good as mine. The magic 8 ball on this slide is kind of an allusion to the fact that people are always asking me to predict the future these days, and it's hard to predict. I really don't know what's coming next. So if you're interested in learning more, here are various links. You can check us out on Facebook or other social media sites. We also have a twice weekly email newsletter that you can sign up for if you aren't already signed up. So with that, I would be happy to take questions or comments or discussion points that you have.
Thank you so much, Maria. That was fantastic, and a beautiful presentation as well. Terrific graphics. Very
Oh, thanks.
clear.
That's
So
all our graphic designer's doing. She's great.
it was all very clear, very in keeping with your brand. So thank you. If you have questions, you can put them in chat, raise your hand, or just unmute yourself.
Yasmin. Hi, Maria. I just
Hi.
wanted to thank you all from a personal perspective because I'm a huge follower. Just thank you for doing this. It's incredible and how much dedication and time you put into this. It's so important.
It has felt very rewarding to do. I mean, it's, especially early on, I think many of us were kind of struggling with this sense of not quite hopelessness, but not knowing what it was that we could do personally to help in a situation. And I think this is what kept us going at first, is that we really did have the sense and still do have the sense that this has helped. This has helped a lot of people, and that feels good. And so it has been really, really rewarding work. And yeah, I appreciate you saying. It was also too much. It was unsustainable work. And so that, for me, that was where I did really hit my limit in May, and have learned a few lessons about keeping things at a more sustainable level, and also what it is that I really like to do. It turns out, even though I'm pretty good at doing news media interviews, I hate it. I hate it. And so I just don't do them anymore. I just say no to all of the interview requests, and other people, I think, enjoy them more. And so I'm happy to pass those off to other people and get back to the thing that I really like doing, which is research. So that's what I'm doing now. Jen, did you have anything? I don't know. Jen was on a train when we started here. Did you have anything you wanted to add here?
No, I'm on a bus, so it's probably
Okay.
not the best, but no, I loved hearing the story from the beginning from your point of view. So great job.
Thanks. Jen was also on board from the beginning, so.
Sarah, did you have a question?
Yeah, thank you. This is one of the more compelling talks I've seen in a long time, so it was well worth my Zoom credits. Thank you so much for a clear and honest and funny and compelling talk. I think many of our colleagues, particularly I think the more junior folks that I work with, are extremely interested in more practical, immediately applied work in bringing their science to the public in a helpful way. And I'm curious how y'all navigated sort of your professional obligations and potentially the views of some of your colleagues and more senior colleagues about how you were spending your time and how you were fulfilling different obligations. I know you're thinking about strategic ways to get funding to do this, which is a more traditional thing that people will reward you for. But I'm just curious, and I mean, you can be as candid or not candid as you want, because it's a pretty personal question. But I'm just curious about the interface with your institutions and sort of, I know that a number of you are fairly senior and sort of tenured and so forth. But how were there any particular instances you can think of that that arose for folks in terms of building this into their portfolio?
Yeah, you're right. So some of the contributors are very senior, but not all of us. And for our more, as Jen says in the comment in the chat here, this is definitely a challenge for me and other of our more junior colleagues, because it doesn't fit neatly into a tenure packet, right? Like, what is this? I think all of our institutions, I can't think of an example of anyone's institution who didn't say that they really valued this work. So I work in an applied population laboratory, and part of our mission and part of my job description is actually applied science communication. And so they really said, like, this is great. You're doing your job. Nice work. I also personally had the flexibility of the K Award as my main funding. And my K is about herd immunity. And so it wasn't like so far out there that I couldn't say this is ultimately going to contribute to the work I'm doing for my K award. It did reach a point, like at first, and the other thing is, I think when we all got into this, we all thought it would be like a couple of weeks. Like, we definitely didn't have some long-term plan for how this was going to fit into our career trajectories. It reached a point for me where I was like, okay, I have to do my job. Like, I have to stop paying so much attention to this and do the work that I get paid to do. You know, is particularly my K award research. So I don't know, it's a little bit of a balance, but on paper, my institution found all, especially the media appearances, they loved that. They were very excited that, you know, the University of Wisconsin-Madison was getting a lot of good press, and that I was out there, you know, doing media appearances. I even learned that there's such a thing as a media value report, which any of your media managers at your institution could pull for you, which says how many, the estimated dollar value of your media appearances over the past year or months or whatever. So that was something that I had my media person pull and included in my my annual review to make sure that, you know, there was a number on how much I was contributing to the university. I'm not in a tenure track position. And so the whole, like, how does this fit into my tenure dossier was not as important to me, but it's a huge challenge for some of our contributors. And, you know, ultimately we really have to publish based on this work in order to kind of make it count in that traditional academic way. And so that's one of our big focuses right now, is to get some publications out.
Thanks. We had a question in the chat from Ann Clark. Ann, would you like to unmute and ask? Oh, okay. I'll just pass it on. How do you communicate uncertainty and lack of scientific consensus to a lay audience?
Yeah, it's really hard. It's really hard. We try to do this in a number of different ways. One of them is that thing that I was talking about, where we actually try to build media literacy and science literacy in our audience. So we have whole posts that are just about what is the scientific process, and, like, you know, what is uncertainty? Why is nobody sure about what's going on right now? But, you know, I think that what we can do with a post is really a drop in the bucket, and the bucket is the bigger problem of a real lack of science literacy, really fundamental lack of science literacy in the general population. It's hard to fight that tide, you know. So I feel like we're often swimming upstream on there.
And another question from Sarah in the chat. Sarah, do you want to ask? Or?
Sure. I guess this is just so fascinating and incredible and different than what I've been spending my days doing recently. But I really took your comment to heart about hating doing interviews, because I don't do interviews anymore either. And I realized that I don't have to have that comment section in the newspaper article like looming and try not to look at it and so forth. But the sort of emotional and practical costs and strategies you used for managing feedback. So in the comment section and stuff, you mentioned that sometimes you had to, if you had sort of repeat offender people that were being unhelpful, you had to ban them or block them. But I'm sure you got so much comments and feedback. And as a professional population scientist, I think, you know, that's something that some of us take on and some of us don't. And I'm just wondering, and I don't mean to pry, and it sounds like there was just sort of a point at which the whole totality of the work, you know, became something that needed to be shared a little bit more. But I'm just curious, like, as a group, how you navigated that rather than as an individual, when you put out an article or you do a big interview or something, and then you have to kind of like handle that on your own. How did you think about it as a team?
Yeah, well, so I'll tell you, I think that one of the only thing that made it feasible for me to do emotionally was to have the team, right? Because often we would get, it's kind of like you kind of have like a support crew out there who are going to back you up, are going to reassure you that you have not overstepped, what is reasonable to say. And you also have people, like some people really do take it quite personally when someone gets persnickety in the comments. I find the comments like incredibly irritating, but I don't take them really personally in terms of like, they don't give me a lot of anxiety or, make me feel like I'm a terrible person or a terrible scientist or anything. I just find them irritating. I just want them to shut up. But some people do. And one of the things that we've done is delegate. I talked about division of labor. One of the things we do is we have a community engagement lead. Joanna Dreyfus is a master's of public health and a stay-at-home mom who volunteered with us to read the comments and ban and hide people as needed. And so that's what she has been doing. She's been doing that for a lot of months now, and she seems to love it. I mean, she says she really enjoys the work. So, part of it is definitely that division of labor, doing the things that you can do, not doing the things you can't do or that will destroy you. And, making sure that you have that support system in the background to discuss something, talk about it when it's something really scary or something really questionable that someone has said. The other thing, we've heard a lot about public health professionals getting threats over the course of the pandemic. We have not, by and large, received threats. I've gotten some really nasty personal comments, but not threats. And I also think that part of that is that we are a team. It's a little less easy to attack us because we're a group rather than just one person with our name on our Facebook page. So we're buddies with some of the other folks who are out there doing this work, like your local epidemiologist, Caitlin Jetelina, and your friendly neighbor epidemiologist who is Emily Smith at Vanderbilt now. And both of them, it's just one person, and they get, they have to navigate that on their own, and they do get threats. Emily in particular has had some really serious threats against her children. She ended up having to move a couple of times because people were kind of like chasing her down in her front yard. Really crazy stuff. And so we've been lucky / strategically playing up our teamness to prevent that kind of stuff. So
this, your answer to that may lead into a question we have from Aaron Ice. So Aaron, I'll let you ask your question if you'd like.
Yeah, first, thank you for this work, and this talk is super fascinating and important. I mean, my question is basically both how the team came about as all women and how it seems like you explicitly decided to communicate that it's all women. So how that decision came about and what sort of reactions you got to that.
It started as an accident / a product of who does this kind of work, right? Who are the people who are in public health and in science communication? Well, it's women. And I think that's because of some structural factors in our society. It also, we've seen some really good evidence of this during the pandemic. Who's going to step up and try to help the community? Well, it's women. It's so in the beginning, the people who were doing this work were women, me and Jen and Allison and Lindsay Leininger and the other 5 or 6 folks who've been with us since the very beginning. And we kind of looked around at some point early on. Someone very early on, when it was just Allison and I kind of independently posting on our Facebook pages, said something, I don't, whatever else you're hearing, I'm listening to those nerdy girls. And so we really, I think that kicked us off thinking about the fact that we were a group of women. We are also, many of us, moms, and our kids were home from school, trying to navigate working remotely with little kids running around. Those practicalities, our own personal experience trying to navigate family life with all of this new information, resonated with our audience. Our audience is also 90% women. And so we decided to lean into it. And so far, we have not had a compelling reason to drop the all women nature of our team. I think, everybody, we've talked about it a couple of times, and I don't think it probably won't last forever. But so far, it has been a really positive experience to be all women. We've had some negative reactions to it, but mostly really positive reactions to it. There was a National Geographic article feature about us that talks about the fact that we are a collaboration of women scientists doing this work that was really, it's one of the best things that has been published about Dear Pandemic. And I'll find the link and share it. The reporter just did a great job of kind of connecting all the dots and talking about, why women are doing this work. Why is it that women are the ones who are interested in what we have to say and making all these practical decisions for their family members about, stuff like there's scientists out there who are doing air flow dynamics studies of how virus droplets spread in specific environments. And then it's moms who are like, that's great, but I have a 5-year-old with small ears. What am I supposed to do about this mask situation, right? It's much more practical. And so that kind of interpretation is what led us to the connection with our audience.
We have any other questions? I have one for you, Malia. So you mentioned that the power of the share button, and that your work has been effective because people are sharing it with their more diverse network. So how do you know that?
Well, we can see it on the comments on the shares, but actually there's not a great way on the various social media platforms to see who you've reached with the reach of the shares exclusively. And so one of the things that I've been doing a lot of thinking about is how do I strategically, how would you design a study to find that out? It's an interesting methods question. But so when I say we know they're more diverse, it's because we can see what the reactions are on the shares. Just sort of qualitative, having read those comments. They're much less likely to agree.
Yeah, well, I guess that was going to be my question in terms of both the scope of your reach and then the impact of your reach and how much it's, comes back as kind of something adversarial or naysayer versus, getting the sense that you made some incremental change in how people are thinking about things.
Well, I think that's an empirical question, and it's one we don't really have an answer to. I think it would be really, really interesting to figure out, when we think about doing an impact assessment of Dear Pandemic, what is the impact of Dear Pandemic? It's very hard to figure out how you would assess it. We have measures like how many shares we've had and what their reach is, but in terms of impact on how people's behavior actually changed, what we have is the comments people give us, like what Yasmin said at the beginning, you have helped me so much. The kind of the mental health impact of having a trustworthy source out there comes out really clearly in the comments. The behavioral impact of, did people actually go get vaccinated because of something I said? It's hard to pin down. I don't really know.
Okay, do we have any other questions? Okay, then I think we're right on time. We can sign off here, and I'll invite our pre-doc and postdoc trainees to stay on for a conversation with Dr. Jones, and thank the rest of you for attending what I think has been a really exciting and informative presentation about making real impact in population health. But thank you, Malia, for your presentation.
Thanks for joining
Dr.
me.
Jones, and thanks, Dr. Dowd. We're so glad to have you back and new here. Wish you could be in person.
I'm going to stop the recording here.